Hi everybody, my name is Rachel Wright, and today I'm going to be doing a presentation on the relationship between poverty, child abuse, and neglect. My first question is, how does poverty affect child abuse and neglect? There is an association of a family's economic status that correlates where a child in the family may or may not face some form of child abuse or neglect. The more economic struggle the family faces, the higher rate and severity of child abuse and neglect will be. So if a family is in poverty, there is a higher likelihood that they will have an incidence of child abuse or neglect. Second question I'd like to ask is, does poverty cause child abuse and neglect? Poverty does not necessarily cause child abuse or neglect. There are direct and indirect circumstances that interact with poverty that can increase the likelihood of child abuse and neglect. Some of these things would be like parenting capacity. So if a family is in poverty, parents may be struggling financially, struggling with jobs, and that could hinder their ability to parent their children effectively. The family may also struggle to buy things for their children or themselves that would increase the quality of life that they have. So they may not be able to afford a new car. They may not be living in a very nice house, or they may not be able to provide adequate food for their children. Poverty can also increase the likelihood of negative adult behaviors like substance abuse, which can cause the environment the child being brought up in to be unsafe. There have been studies in the United States that showed raising a family's income of poverty-stricken communities caused a decrease in child abuse and neglect incidences. Does poverty cause child abuse and neglect continued? According to the third National Incidence Study of Child Abuse and Neglect, children of families with a yearly income of $15,000 or less are 22 times more likely to receive maltreatment compared to families with an annual income of $30,000 or more. So families that earn less than $15,000 a year are more likely to be struggling with child maltreatment. How does poverty affect children? Poverty is related to worse child developmental outcomes, such as cognitive development and educational outcomes. So children living in poverty may have fallen behind in school. They may have behavioral issues. They may also have difficulty making friends due to social development being delayed. Effects of poverty include material hardship. So children don't have maybe all the necessities of life. It can increase family stress. So parents are stressed, which causes children to feel that stress. Parental care may slip because parents are stressed out with things like finding a job, paying the rent, buying food, and the developmental environment children are in may not be adequate. So children spend a lot of time at home, and if that environment is not developmentally appropriate, they may struggle to meet developmental milestones. The amount of time a child is in poverty, as well as when poverty began in relationship to their age, influences how the child will be affected. How does poverty affect families? Poverty creates family dysfunction, which can lead to poor parenting. Poverty also increases parental stress, which can reduce the parent's ability to form warm and nurturing relationships with their children. So that's really important because when you're growing up, the people you're around the most is your parents. And if you don't form those strong bonds with them, you may struggle later on in life to form strong bonds with other people. According to the family stress model, poverty can put severe strain on marital relationships and increase feelings of depression. So if your parents are depressed, that's going to affect your relationship with them as well, because they're not going to be warm and nurturing, and that's going to affect, how you feel about yourself and how you can connect to others. Family distress can lead to ineffective parenting. For example, parents may not be able to pay attention to what their children are doing, which can cause them to lose control of the child's behavior. So the child may have a lot of behavioral issues. They may be getting in trouble at school a lot. They may also seem to be very hyperactive because they don't have a consistency at home. It may also create a lack of warm, responsive relationships and bring out acts of aggression or hostility towards children. So that stress that the families are under may cause them to lash out towards their children. This is a graph of the family stress model. So we'll start out with the long-term poverty, which leads into family stress. So that's the family dysfunction. Adult relationships are strained, which can then cause parents to feel depressed. All of those things can lead to hostile or ineffective parenting, and that leads to poor physical health for children and greater hyperactivity. So they may, be very hyper. They may not listen to authority, and that can cause issues at home and in school and just with peers in general. So what are some solutions to poverty and child abuse and neglect? So reducing poverty across the population may have a positive effect on decreasing child abuse and neglect. A study done in Illinois by Shook and Testa in 1997 found that families who received financial assistance were less likely to have a child removed from their home over a 15-month period compared to other families who didn't receive assistance. So the families that got assistance weren't having their children taken away. They weren't being put in the welfare system, child welfare system. Many states have identified poverty as an issue for families involved in the child welfare system. Several states use a differential response to accusations of child maltreatment, which offers family services that can allow the children to stay at home. So the families are getting their needs met, which is reducing child maltreatment. Minnesota is one state that uses this method and provides these families with financial support to help meet the needs of the family, which decreases stress. Several states have used methods such as providing employment grants, assisting families with an enrollment process of welfare, which can be very confusing for some families, helping families find employment who are involved in the child welfare system, holding family team meetings, which can empower parents and give them access to benefits and job training. They've also partnered with child welfare and TANF departments to help families receive needed benefits and training. Early intervention is key in these types of situations. It's important for state and local governments to secure funds for families at risk. Investments in quality childcare programs, housing, and mental health care services can prevent families from suffering due to poverty. Family interventions can empower families and provide needed services that will allow families to avoid getting involved in the child welfare system. So these services can help them keep their children at home so children aren't being removed and moved around from foster family to foster family. The Center for the Study of Social Policy leads two initiatives based on parallel and linked frameworks of protective factors. This includes strengthening families, which is for families of young children, and Youth Thrive, which is for youth and their families and caregivers. Strengthening families is about protecting and nurturing young children while promoting their development. It is also about providing support to parents so that they can build protective factors and be the best parents they can be, even when under stress. So the protective factors that are emphasized in strengthening families are resilience, forming social connections. It provides parents with knowledge on parenting and child and adolescent development, which is important so parents know what to expect out of their children, so that they know that they're meeting the correct milestones. It also provides concrete support in times of need. So if they're struggling financially, they can get the assistance that they need to cover the bills that they don't have money for. And it also provides knowledge on how to be socially and emotionally competent. These are the references that I used for this presentation, and I hope that everybody enjoyed it. If you have any questions, just let me know. Thank you so much for watching.